Hello, Kara. So here I
Yeah.
am, Kiki Dickinson, the Building Healthier Communities navigator and manager. And I'm really excited that Kara Reich is joining us to help us improve our postural stability in our core, which little babies could use all the way up to adults. So why don't
Mhm.
you just introduce yourself a little bit more, Kara, and then we'll go from there.
Yeah, my name is Kara Rich. I have worked in pediatrics for 5 years, worked with little babies up to adults, and talking about postural control, which is really how our bodies fight gravity, which we have to do all day, every day, and just what that looks like across the lifespan. And also just a model. There's so many different approaches to therapy, to strengthening. And so this is just offering perspective of one view of how I specifically, and I think this clinic at St. Croix Therapy really looks at the body from at the beginning. So kind of starting at the middle, what does postural control, what does core stability look like, and moving outwards. Other individuals might kind of like to start from the bottom up, more focused on feet and weight bearing, etc. And so just another perspective on how to approach strengthening and movement and what that looks like throughout the lifespan.
Great. So where do we begin here, Kara?
So we begin with the pop can model. And this is information that I learned at a course taught by Mary Massery. She's a physical therapist in the Chicago area. It's something that was taught at PT school. I went to St. Kate's. And so we learned the pop can model, thankfully, in PT school. And then I was able to elaborate on it after graduation, taking some coursework myself. And then I had the unique opportunity to go down to the clinic that Mary Massery works at
Oh,
and
wow.
work with one of my clients and then see some of these principles and this treatment approach applied to a client that I worked and work with weekly and kind of seeing a difference in that. But the basis is the idea of looking at the core. Lots of people talk about core strengthening and how it's a big deal and how to do it. And oftentimes, the first thing that people think about with core strengthening is sit-ups. And when you think of the core as a pop can, and I have a little picture here for us, sit-ups are really not our friend in many ways. I'm not going to share my screen because I think it gets too complicated when we do that. But if we look at the pop can, imagine that this pop can is the center of your body. So this part of your body as a pop can. Most people, when you mention the core, think about the middle of the pop can, which is your rectus abdominis, that's your six-pack muscles, your obliques, maybe might be a buzzword that you know or hear, and that kind of you have internal and external on the sides, and then spinal stabilizers in the back. But a pop can, if you only had the outside, is not strong. You could crush a pop can very easily if it's only the outside. So you also have to have a bottom and a top to really seal that off to make it strong to be the basis for our movement. The bottom of the pop can is our pelvic floor, which occurs to people more in the realm of pregnancy, postpartum, but everyone has a pelvic floor always. It always matters, not just if you have a
Good
baby
point.
in your belly or if you've delivered a child, it always matters, men and women. And the top of the pop can that helps to seal things off is your respiratory diaphragm. So that's that big muscle that helps you breathe just under your rib cage. And then the little pop top that's going to open and close our pop can is your glottis. And that's if you're holding your breath or not. And so these are all pieces that we can use to strengthen, to challenge, to see if they are tight or strong. And then using that system and that model of a pop can to know, are you compensating? Are you actually holding your breath when you are balancing to try and be as sturdy as you can, or are you using your muscles? You have your voice on, you're counting out loud, and your muscles are working to stabilize that open pop can so it doesn't crush.
Okay, very
So,
cool. Do you find in your practice, I definitely have that lots of people breath hold, right?
mhm. Yes, it's one of the magic tricks I like to show at evaluations to show for sure physical therapy students because it's not always the first thing they look for. And also parents. Oh yeah, they've got great balance. They can stand on one foot for until they're, the cows come home. But the second you ask them to count something that doesn't require a lot of cognitive anything, just turn that voice on, sing a song, anything, they start wobbling like a little noodle because they were actually holding their breath to stay there.
Right. And I notice with adults, that a lot of times if you're in a lot of chronic pain, you hold your breath a lot. And
Mm,
we've seen a lot of good success, haven't we, by helping with this model and other models to help people to learn to breathe, so
hmm.
that's great.
It's really
Okay, tell
important.
us more.
Something that plays into all of this is looking at do the muscles in your pop can, in your core, are they tight, weak, or strong and tight? And so kind of that combination of um, specifically looking at the rib cage and something that is unique and they really don't emphasize in PT school. It's something that I learned outside of school. You have muscles in between your ribs, and they need to move to breathe, and you need to be able to breathe to have a strong core. And so it really all goes together. On top of the fact that even within the pop can model, your diaphragm at the top interacts with your transverse abdominis, and that's a big fancy word for your body's natural core set. So it's your deepest core muscle. If you were to wear a back brace, this is your body. Your body already has one. We just have to learn how to turn it on. That's your transverse abdominis. And as someone who was an exercise science major in undergrad, I didn't learn about this. I learned like abdominal sets, but it really wasn't until physical therapy school that we learned about the transverse abdominis. And one of the beautiful things about the transverse abdominis is it really covers the whole inside of your pop can and it's interwoven with your diaphragm. It's this really cool looking anatomy. And so when your diaphragm really kicks on and you do this long exhale, you go as long as you can. At the very end of it, if you do it for yourself, you can feel this tightening, and that's your transverse abdominis kicking in because of this beautiful woven. So it's first the diaphragm comes down and in, and at the very end, it pulls your TA on, your transverse abdominis on. And so that's something where it works into intervention possibilities. Something that is very common around St. Croix therapy is you will see bubble wands, bubble buckets, bubble blowers, and we are using that as a way to lengthen and strengthen the diaphragm for the purpose that at the very end of that exhale, you get that nice tight contraction of your transverse abdominis. And it's helpful for kids and adults. This is one of the hardest things to cue, especially for adults, and it's maybe more acceptable and fun for kids to just have them make a bubble volcano instead. So because of that, we talk about the diaphragm a lot. We look at rib mobility. Do your ribs move? A lot of times, if your pop can needs to be strong, our bodies are smart and they're going to bog down where our muscles aren't strong enough, and create tightness. And our bodies are just beautifully made that way that it can compensate so we can do what we want and need to do for a while, and then sometimes it leads to pain eventually or
Let's
compensation.
let's discuss different compensations that people might see in their own children or their infants or their own self, right? So one
Mhm.
is I know a lot of times like if you think about lifting something that's super heavy and you like
Mhm.
hike up your shoulders, you might hold your breath and all those things. So that would be a compensatory mechanism to not
Mhm.
using the right muscles, right? What are some
Yeah.
other ones that we can talk about?
Yeah, everything on a spectrum. Holding our breath to make our bodies stronger isn't always a bad thing. If you go and open a heavy door, any able-bodied individual will probably close their glottis and hold their breath a little bit. It won't be dramatic. It won't be
Yeah.
holding their breath. It's very functional and so it's a spectrum of things, of course. Other things that we see, especially when we're working with this system. So you might see kind of the hip hike or the shoulder hiking, holding breath. When we're working on exhalations, you'll see if it's kind of some weakness up in the oral motor, you see chipmunk cheeks, they'll go to blow and you get this. So
Yeah.
we've got some chipmunk cheeks that you might see, and you might see that someone pulling open a heavy door. They might
Yeah.
um, chipmunk cheeks, and then other, especially with kids, you say, okay, let's see this nice long blow, and they don't have the control or the strength to do that. So instead, they're gonna as hard as they can and as fast as they can. It takes control and strength to be able to get that long exhalation. That's a coordination and strength piece. And then often just if you're trying to do a movement that's too hard, you're gonna compensate in your alignment. You might be rolling forward or throwing yourself back, and that's where a lot of musculoskeletal injuries happen in our adult population, um, and might just be a posture situation for some of the younger kiddos.
I
And
also
then
thought we could I also thought we could describe what a lot of the kids with special needs, what their posture kind of looks like and why this is more challenging for them is a lot of times children don't like if they're delayed, their
Mhm.
sitting was delayed
Mhm.
and their being upright was delayed. So then that diaphragm didn't develop as quickly and as well. And so
Mhm.
you'll see that it doesn't take up the rib cage is much higher,
Mhm.
right?
Mhm.
And not as activated. So these are things that are going to help your kids to improve and like I said, as well as adults. That's the nice thing about the pop can method is it can work for everyone to understand the breathing piece, right?
Mhm. Yeah,
Okay.
really just looking at the belly and the chest when they're breathing. It's normal to see the ribs kind of start like a triangle in
Yep.
our young kids, and then as core develops, as our rib cage kind of comes down. And then what we would look for in an assessment for physical therapy is when we take a big breath, are your rib cage is your rib cage doing this nice up and down motion? We call it a bucket handle
Yeah.
motion. Is that happening? Because that's what the diaphragm is going to facilitate. I think it's also important to mention not everyone needs to be a diaphragm breather all the time. They talk about breathing patterns isn't good or bad. It's just, is it serving your body and your needs? Um, for many of the individuals that we work with, if they have known respiratory difficulties, you might see retractions. And that's where the skin in between your ribs is going to sink in when you breathe in. So it's really the opposite of what we would expect. All that's telling us is that the muscles in between the ribs, the intercostal muscles, actually aren't stronger than gravity outside of it. In our typical population, that's when we're going to the doctor. We have like, oh, those are retractions. We're wondering if there's RSV. Are there any other symptoms happening? But for some of the families we work with, that's baseline, and that's something that they live with and is expected. But we can still strengthen those things by learning how to turn that diaphragm on, pull in these extra strengthening techniques. Um, and we can see all of that based on what the rib cage looks like. Is it still underdeveloped? Does it still look like a triangle? Or has our core muscles, are the outside of the pop can, if you will. Those obliques really come down to help bring it in, bring it into this alignment. The other thing that we see is asymmetries on one side or the other. So is there winging? Like is the ribs like flat and equal, or do you have one side higher, one side lower? Do you have winging on one side where you can kind of like even get your finger up and under there? I had winging in my core as a kid growing up. And so those are all things that you can see, especially if you ask your kid or even for yourself to stand in front of the mirror and just take a big breath. What's moving, what's not. Those are things that we would look for so that we could strengthen around it. And then those are techniques that we can use for strengthening. First of all, we can do blowing. That's going to strengthen that diaphragm. And like I mentioned before, trying to elongate that exhale. It's as long as you can go. We really tell kids longer, like a medium breath. We don't want it to be so little that it takes 20 seconds. That's a little too long. But a lot of times kids just want to short and fast. So we want to kind of find our happy medium if possible. In clinic, we use different techniques, kind of just like you would with different weights. You would lift a 1 pound weight and then a 5 pound weight and a 10 pound weight. We can do different levels of resistance, different levels of strengthening with exhalation as a way to strengthen the core. We kind of start with bubble ones. That's kind of our 1 pound weight. And then you can work up to the bubble blowers or just a straw. And then we can use tubing. And the last step is a balloon that has quite a bit more resistance to it. So that's kind of the progression that we use. And then once we once I feel confident that in clinic I'm not seeing too many compensations, our chipmunk cheeks are going away, and we're able to kind of, do a 5 to 10 second exhalation without really losing our posture to try and make it there, then you can send it home, and it's such a fun, easy activity to toss a straw in the bathtub during bath time and kind of blow there, or just taking your popcorn bucket, whatever that looks like at home, adding a little bit of dish soap and making a bubble volcano at home.
Yeah,
Um,
that's very motivating. They love when it starts going over the edges and and things like that. So yeah, there's definitely I was just thinking about like there's like you said in school you learn about respiration and luckily you did learn this pop can method, but a lot of times physical therapists and occupational therapists don't learn a lot about respiratory respiration and how important it is. So our
mhm,
St. Cry Therapy definitely focuses on this and other clinics as well. But if you're watching this and you're at another clinic where they haven't done any blowing, we're hoping this will help you understand the benefits and what you can get out of it, but also like maybe asking them like, hey, I've heard about how blowing could help. One thing that I think is really important for parents to understand, like the reason we want that long exhale is that it's a 1-to-1 ratio, that it facilitates that longer inhale, so you're getting
mhm,
more breath, and that's going to help with posture, like which is our main topic, but it's also going to help with breath support for longer sentences for kids when they're talking and things. So there's so many things, that their endurance. We work with a lot of kids that can't keep up with their parents or their peers. And so the
mhm,
breathing piece is something that's easy to do at home.
mhm.
And then I was thinking, what about the kids that aren't able to follow those directions, or their parents are sitting here going, well, if I gave them a straw, they'd just be drinking.
Yes.
So let's talk about other treatment ideas we can give those kids or parents.
Yeah. The drinking part is tricky. I pinch the straw and then demonstrate is one of the techniques. And if they figure it out, they figure it out, and that's fun and great. If not, it's it's not the end of the world. There are other techniques. There's a couple of ways that you can cue breathing that isn't just telling them to breathe out.
Yeah.
And so that's something that's interesting, especially in our population who are in a wheelchair or maybe not like ambulatory, you can use your voice and positioning of their body to encourage either an inhale or an exhale. And so there's all sorts of different cues you can do, but some of the quick and easy ones, if you want someone to take an inhale, you can either position their body back. And it can also be an arms up thing. So it can be coming behind your child and helping them extend, and you can feel it for yourself. If you bring your own arms up, your lungs fill with air, which is so helpful, but silly in a lot of ways. And then the opposite is true. So if you're trying to help someone exhale or even especially cough, I've used this technique with some friends, some non-ambulatory friends specifically too. You bring them up, get that air in, and then you're going to go down and fast and kind of help them bend forward. I've also done chicken arms, they call it. So you bring your arms up really big, get a good breath. You can also use your voice. A loud, fast, sharp sound is going to make someone, and so you can use a loud voice to go, and then a low, deep voice with flexion is going to, and it's super fun to do. I've had so many giggles with some of our patients, and it helps encourage a good cough. You're going to get that good diaphragm um, activation, and also just getting your hands on them. I think that's something that is just even as a parent, like if I wasn't in this position, I don't know that I would ever like touch my kid's ribs. It just doesn't. Why
Right,
would you, right? But
right.
especially when, the sniffles are going around, they just sound kind of junky. It's something that I really encourage all of the parents that I work with, just like rubbing their ribs, getting move them, and it can be really like a sweet moment when you're cuddling, laying in bed, really good connection time, but also really functional.
I had some really good luck with over exaggerating my breathing too.
Mhm.
Um, so taking a really nice deep inhale and then taking a nice exhale without talking to them about their breathing and just seeing if I can get them to do that. And I've had some nice luck with that. And
Mhm.
when Kara was talking about putting your hands on them, some of the cues we've learned from Mary Mastery is like telling them like breathe into my hands or fill up my hands, not push into my hands. Because once you're saying push, then it's like this, or
Yep.
instead of like they're visualizing, but then you can by holding on their rib cage, you can tactily give them a little feedback. So you're not pushing in, you're just giving a little light pressure, and then like fill up my hands like it's a big balloon, and then
Mhm.
exhale. And
Mhm.
that can be nice. Other things I've seen used is like ping pong balls and cotton balls, blowing those across the table at each other. Um,
Mhm.
there was a therapist here years ago where she would take a straw, a little straw, and I don't know if it was paper, whatever, but then she'd have them like inhale and then like get it to stick and then bring it over to another area. And that was kind of
Yeah.
cool. I don't know if you've done anything like that or have other ideas like that, but definitely can make it really fun.
Yes, so fun. The cotton ball chase is a really fun one. See who can get it across the table first.
Yeah.
Especially at restaurants, that's an easy place to practice those things. I wanted to double back to the other part of this in the PopCam model is looking at because it's a closed system and it all works together, what the diaphragm does up top actually is what the pelvic floor does on the bottom. So when this goes up, that goes up. When this goes down, that goes down. So we can use these techniques. We're working on the diaphragm, but what's happening is the pelvic floor is following. It's a physics concept because they're parallel. Whatever happens here happens there in a closed system. I'm not great at physics, but I use it every single day in physical therapy. So kudos to the prerequisites for physics into physical therapy. Um, but all of that plays into pelvic floor, and I think we see that across the lifespan as well. I mean, you have these little babies who have, this immature weak core and they cough and they toot or poop at the same time, that's a weak pelvic floor because their core hasn't developed yet. But then we also see that across the lifespan. If you struggle with incontinence, like stress incontinence, or after you have a baby, if you sneeze and then pee, while it's common for that to happen, it's not necessarily normal. And so these are techniques that you can use as long as you're breathing correctly. Any activity you do can be core strengthening. And that plays into your pelvic floor. And then we really get into the cycle about like potty training and constipation. A lot of so many people think that you need to push to go to the bathroom always. And actually, going to the bathroom and voiding should be a relaxation of the pelvic floor. Um, and what that looks like from a breathing perspective, and how you can take a breath in and exhale to relax your pelvic floor while you're going to the bathroom. Um, and or teaching little kids how to go to the bathroom. The other piece too is because the diaphragm in our pop can model is at the top, and inside our pop can is all of your digestive system. When your diaphragm is going up and down and up and down, it's also massaging your digestive system and helping to work things down. So it's not uncommon that we have kids come in and we do a bunch of breath work, or we're doing work on their rib cage and doing some core strengthening. And then, oh, they haven't gone to the bathroom in 3 days, but after PT, they were able to go. Very,
Mhm.
very common occurrence around here.
I don't even know if I've told you this story, but I have a preteen that I work with that is deconditioned. Her primary diagnosis is autism, but of course, as a PT, we're not treating autism, or, of course, OTs too, we're treating things that autistic people have impairments. And so
Mhm.
for her, I was trying to get her stronger so she could keep up with her family and her friends and be able to like even balance to get in and out of the bathtub
Mhm.
independently. But we were seeing her twice a week, and once a week we go in the pool, and once a week we do land. And we did a ton of blowing, ton of core work, and all of a sudden, her mom came to therapy, and neither the OT or PT, it didn't come up during the assessment. They said that she started not voiding in her pull up, and she was able to wear underwear to bed. And she's like
Mm.
11, and it's the
Mhm.
first time in her life. And so that was
Wow.
like super exciting and huge. So even
Yeah.
though we didn't know, we weren't focused on treating that incontinence at night, it made a
Mhm.
big difference. So I think that can give a lot of parents hope for those kids, because it's just one more thing that they have to deal with and families
Mhm.
have to deal with. So
It
um,
is.
one thing I just, with this being a resource for everyone, one
Mhm.
thing in case I can help one person that's listening to this at some point is that Wisconsin Medicaid, after you turn 5, I believe, they cover diapers and pull-ups, and they don't really tell all the things they cover, but that's one thing they cover, and
Mhm.
that can add up to a lot of money. So if you have the Katie Beckett or the Medicaid, um, there's ways to get that. A lot of times people go through a pharmacy or through like a store or something, but and
Mhm.
get the monthly amount. But definitely something to know, because I just am always sad when families like come here with a kid that's 10 and they didn't know that. So yeah.
Yeah,
Okay,
that's a
sorry
great resource.
have a little divergence there. But what else do
That's
you have
okay.
for us, Kara?
I think all of this comes back to as well. Another reason why this pop cam model is so important is ultimately the body is going to prioritize breathing. And one way that we know that is it's the one thing that your body has to focus on when you're sleeping. And so one of my favorite questions to ask at evaluation is, what does your kid look like when they're sleeping? And what that tells me is depending on if they're on this side or that side, if their hip is bent or their arms are here, it can tell us what their primary way of breathing is. Do they like to be a belly breather? Are they using their diaphragm most of the time? Are they using more of a lateral breath? or are they a belly sleeper and it's actually in between their back and that's where you're seeing it. So that's kind of the beginning of when I do an assessment and I'm looking at breathing is first of all, what when nothing else is on, when you're not thinking, you're not moving at all, what's working for you? And start with that. That's going to be your strongest pattern, and then working away from that. Um, and really seeing most people, they talk about it in the coursework from Mary Massery that it's not good or bad. It's kind of like being right-handed or left-handed. Most people are chest breathers. And then and then you could have some lateral breathers. You're going to come out to the side when you're breathing. Belly breathers are most common with individuals that have lower tone, is kind of the one side of it. So, kind of Down syndrome, any of those types of things, you're going to see, primarily their belly moving a lot, or if it's been trained. Swimmers,
Singers.
singers
Yeah.
they've worked on that pattern. Again, it's not wrong. There's no right way to do it as long as it's serving you. And then having the ability to play into all the different ways when you need it, when you're running hard, when you're working hard, or for some of our kids that have respiration challenges, just day-to-day breathing is is hard work and they need to be able to use their chest and go out and their belly and they might still have, retractions at baseline. So that's where, from a PT perspective, we're going to make sure that you have access to using all of those things and have those online as you need. And then for some of our older kids, our higher level kids, then we can look at implications of it, right? Is your core strong enough that you can not just that you can stand on one foot, but you can do it while you're talking so that the pop can is open. It's not just closing everything off. It's the pop can's open, it's your muscles that are holding you up, not just air trapped inside. Um, and then progressing that into jumping, running. You have to have a strong core to be able to do that. And that's some of the just really fun progressions that we see with some of our kids that are working on those earlier developmental milestones as their core gets stronger, they are able to go from sitting to tall kneeling, just more upright positions where they're fighting gravity more often.
I see sometimes we'll have kids that are getting OT and then all of a sudden their PT's like, or their OT's like, hey, they maybe should also get PT. We go back and forth and help see, like, because it's not just one discipline that addresses all this, of course. And so we're both PTs, so we're talking about PTs, but we have OTs. There's OTs around the country that do work on breathing and also speech therapists. But one
Mhm.
other thing I've noticed, and parents, like, they're more kind of sometimes annoyed by this or whatever, but their kid is like always leaning on their hands at dinner, or they can't hold themselves up in school. They're falling off their chair when they're in the waiting, like when they're waiting at the grocery store, they're leaning on their parents or on something. And so
Mhm.
sometimes it's annoying as a parent, you're tired or whatever, and you're just like, could you just stand or get off me or whatever? But it really is that they're lacking that postural stability to kind of
Mhm.
keep upright. And so when they improve their core, they're able to be more successful with that for sure. So
Mhm.
those are some things that parents don't always think about because if they're focused on like the child's handwriting or other things, but if they don't have it, that's why they're leaning or, fidgeting all the time. We also have a lot of kids that come here that they can like run around and they can hop on one foot, but they can't stand on one foot. And that's, and you can add to this, but like definitely they're hop, they can keep going, but they can't just stand still. And I always equate it when I'm talking to parents is that like when a toddler learns to walk, they don't just like walk and stop in the middle. They like walk super fast with their hands up and then they go to the from the couch to the chair. And then
Yes.
over time they're able to stop in the middle. But yeah, if you
Mhm.
have anything more to talk about with that, that would be good.
Just a little bit of in many of those scenarios, it's really controlled falling more than purposeful walking. I don't know if you've ever done any like yoga classes when they have you do active standing and they really talk you through all the different muscles. Most of our bodies are smart and they conserve energy in any way they can. But when you really turn on all of those muscles, standing and standing still takes a lot of work and energy, and it can be a really good strengthening piece. The other thing I did want to mention is because it's not uncommon that in OT, they will use bubble buckets as well, but different reasoning, different clinical reasoning most of the time. And I tell parents that because bubble buckets or a bubble volcano can be that long blowing can be a really great regulation tool. That long exhalation triggers your parasympathetic rest and digest calming nervous system, that long exhalation versus your fight or flight is going to be when you're taking lots of short breaths in. And so it's kind of a double whammy in that it can be a calming activity while you're strengthening, as long as you're in a good position and you are doing an appropriate amount. Most of the time, from a clinical perspective, I would have a kid start blowing, laying on their side where gravity's not so hard on them. They're not trying to stay up and blow. We're just laying on the side and seeing how the muscles are working. And then as they get stronger and they can turn on all the different ways of breathing, then having them move into, a more um, anti-gravity position. And so that's kind of where OT and PT differ. Like if you're just going for let's just blow as long as we can, that might be more of a regulation tool versus I care about how long the straw is, how deep the water is, and what their body looks like. And I'm looking for compensations from a strengthening perspective. So that would be a difference. But ultimately, I mean, you can get positives from the same activity for different reasons, which is helpful.
I do a lot of birth to three, as you know, Karen. I've so many times these kids that have like low muscle tone, and it's not like tone, I mean, that's a whole nother talk, but like the kids that they're just a little more floppy and they don't always sit up that well. But sometimes their parents will say things like they're just kind of lazy. And that's
Mhm.
my one, like I feel like that's like a swear word. Like I
Yeah,
always just really
yeah.
try to educate the parents, like they're not lazy. They're
Hmm.
just compensating. And everything when you're a little bit weaker in your core or you have some sort of diagnosed condition for your muscles, like you're going to compensate and everything takes way more effort. And sometimes the motor planning takes longer, but I just try to restructure that really early, like let's acknowledge the fact that it's harder for them. And I
Yeah.
always say, like, well, when you come home from work after a hard day and you sit on your couch, like, are you gonna, like, if there's a back on the couch there, which all couches have, are you
Mhm.
gonna lean against her or are you gonna sit up straight and, activate your muscles? So we all have, times where we're like, oh, yeah, I just don't want to have to work so hard, you know?
Yeah,
So, yeah.
absolutely. I will echo you on that. I tend to be a bit more of like an objective person, so I add numbers to it. If someone
Okay.
has lower tone, if they want to do a movement, and say your average person, it takes 5 units of power or something, like it takes 5 to do this movement. Someone with lower tone is going to need to put in 7 or 8 units of power to
Right.
to get something done. So they just are literally, it just takes more work to get the muscles to turn on to do what they need to do. And over this course of the day, I mean, that's a lot of it builds over time for sure.
Right.
And that
Thinking,
brings,
oh,
go ahead.
go ahead. I was saying, thinking about that quantitative, there's so much research on like children with cerebral palsy, more so than there are research on kids with like other, like, not like DCD or developmental coordination disorder, but
Mhm.
they like some kids with CP that have spasticity and but they're ambulatory. They say
Mhm.
like they expend 80% more energy on average
Mhm.
walking down the hallway. So just think how fatigued they must be at the end of the day. And I always am like talking about nutrition too. Like they have to eat so much more and get so much,
Yeah.
protein's the big, the big thing right now, but like they
Mhm.
need lots and lots of
Mhm.
food for energy. And also thinking about like how does that affect their learning and things like that.
Yeah.
So
And then where do
yeah,
we come in and how do we support those things? Like, of course,
yeah,
from PT, we want to build that strength. We want that to be there. Or and
yeah,
depending on where they are developmentally, how do we support them? From a PopCam model perspective, sometimes that looks like actually adding something like, can we put on an abdominal binder? Like, okay, we know your belly's not strong enough, we're having a hard, but we want you to be able to sit, right? So we're going to add an abdominal binder to strengthen the outside of your PopCam, to give you some more postural stability, or like a SPO product is something that we've used, just to help turn those muscles on or just give more stability. A TLSO that has support for the back that's going to help bring up that postural piece, but it's not just so they sit up straight. It's so they can be upright and then reach or walk or whatever, right? Like it's just the beginning of movement rather than not everyone needs to be here all the time. Um,
right,
but just
right,
adding in those pieces of where can we support, knowing that there's so much energy expenditure, where can we add supports? Um,
right.
and and many times, especially with kids with CP, whether they have tone or not, adding an AFO and giving
That's
stability
a
to
brace
a
for their
brace,
ankle. Yeah,
adding braces to the ankle, it's if you think about the ankle, um, it can move up, down, side, 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 and then like a little rotation. That's a lot of movement for the brain to deal with, and they're very little muscles, and they're really far away from your brain. So all of that takes more energy, more coordination, more power to handle versus if you put them in an AFO, obviously this is all in the compensation or in, compensatory side of things. But if you put them in an AFO, it's less for their brain to think about so they can focus on like lifting their leg as opposed to this little movement in their toes. Um,
right.
and just giving encouragement to families that it's not an always thing. Sometimes it's for the moment so that we can do things. Because at some point, developmentally, like a kid wants to be upright and sitting or walking. And if for whatever reason they're not able to fight gravity well enough, how can we support them so that cognitively they can explore their space where they want to be and where
Absolutely.
they're ready to be exploring?
Yeah, for sure. Well, this has been super helpful, and I'm hoping people really enjoyed it. Definitely feel free after you watch this, as we've recorded it, if there's comes up with other topics like that you're like, oh, I'd also like to know about that. Please respond in the comments in the Building Healthier community so we can continue to bring you more informative information. So thanks so much, Kara. And now I know how to say her last name. It's Rich.
It is. Yes.
So, all right. Well, thanks so much, and you have a good day.
You too.
Bye bye.
Thank you.